We are a single hospital, 114 bed acute care facility. We have 28 clinics, with 8 of those being rural health family medicine clinics, and the rest are various specialty clinics. We also have rehabilitation and home care services. And we have been on Expanse since January 1st, 2020, as I said. When we went live with Expanse, we moved from multiple different EMRs, one of them being Meditech 567, Client Server 567 in the inpatient setting, Allscripts in the outpatient setting, and we had T-System in the ER. As part of our overall implementation, I did a deep dive into problem list management, and some of you may have attended some of the presentations that I did way back then on problem list. And for me, I never really understood problem list as a physician prior to delving into why the problem list existed the way that it did. And I looked into the history of it and was really quite surprised that it had nothing to do with electronic medical records in terms of where it originated. It originated in paper records back in the 1970s with family medicine providers who wanted to sort of create the concept of a table of contents, so to speak, of what a problem list, of what all the diagnoses were that the patient has, and that's where the problem list originally originated from. And electronic health records just evolved sort of around the concept of a problem-oriented medical record. And just that simple bit of knowledge itself helped me to understand how so much of what we use in the electronic health record is tied into what is on that problem list. A lot of the clinical decision support and other elements that can potentially help improve efficiencies. If you don't have an accurate problem list, you're not going to see all of those benefits down the road. And as I'm sure many of you have experienced, problem list governance is a huge challenge. So with our Expanse implementation, we really, as a group of providers, delved into what we wanted our Expanse problem list governance to be and had a really good process in place. When we went live with Expanse, we did not convert any of our problem lists from our other medical records and sort of started with a clean slate with providers putting problems on problem lists that were chronic problems that needed to be there, not necessarily including all of the transient problems, and not pulling over information from other records that was no longer relevant either to current care or even historically, and also not pulling over the many, many duplicates that were seen in our other records.